But it depends on your anatomy. So some patients, like me, I have my mother's neck, but I'm 54, so my skin tone would probably be a very good responder to Vaser. It would be a beautiful result, but it may be that if I have laxity, because if I gained 50 pounds and lost 50 pounds, my skin elasticity is something I'll assess with you at the time of your consultation. So I want you to know that it depends, and I don't mean that in a way that says it depends on your budget. It really depends on the outcome goal that you and I identify prospectively with you in my office and me and you talking about outcomes. That means we show you pictures of other people who've been in your pathway, similar genetics, similar age structure, but it's really not about the age. I tell patients, I'm not treating a number, I'm treating your anatomy. So some patients have very dynamic platysmal lines, they've separated. So it depends. If you have very active lines here, then we usually want to put those together back where they were in your 30s pretty much. I tighten the muscles and get a nice cervical mental angle, and that means it's going to restore the aging neck to a bygone era. But sometimes a person says, I just want a little better, and that's where I say, okay, expectations will meet expectations. Vaser, we introduce something behind your ear and under your chin. It's 4 millimeters, which is 1/8 of an inch, and put a little fluid in there, and then Vaser is an ultrasound energy that selectively liquefies the fat. And then your immune system tightens that up. The ultrasound stimulates your skin. There are muscle fibers in your skin that tighten things up after a wound is made. So a patient who has a certain anatomy can have Vaser. A patient who has a certain anatomy can have Vaser and some neck muscle tightening. But I always put it in context of outcome goal and what your tissue dynamics are like.